What is the management of infected knee replacement? Number one, the infection of a knee replacement surgery is very difficult to manage. That's why we take utmost precaution in avoiding infection in a knee replacement patient. The surgery is carried out in the best possible aseptic operation theatre. Second thing, we screen the patient completely before the surgery to avoid having any septic focus. But if there is infection which has occurred in the knee replacement, then the management is again surgical. If infection is early, it can be washed out by surgical procedure, drainage can be done, and IV antibiotics are given. If everything settles down, IV antibiotics are continued for 6 weeks, and again markers are done. If markers, that is infection markers such as ESR and CRP, come down rapidly after washout of the knee joint, then chances of getting rid of infection are good. If infection continues and it becomes chronic, then a major surgery is required. In that, the implant which has been put in the primary knee replacement is removed, the knee joint is washed out, it is debrided, and a special implant is put which has a cement impregnated with gentamicin or vancomycin. Along with that, stimulant granules can be put into the knee joint to avoid any infection again reoccurring. After this initial procedure, 6 weeks to 3 months later, a second revision knee replacement can be done to get good range of motion. The chances of infection in a second knee replacement in such an infected knee are up to 5%. So, knee replacement infection can be managed, but it is a tedious and long procedure. Thank you.